Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session is about best practices for antepartum or prepartum reporting and high-risk pregnancy cases. So best practices for antepartum reporting and high-risk pregnancy cases within Chapter 27, and Chapter 27 is review of OB GYN scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Best practices for antepartum reporting and high-risk pregnancy cases address one of the most critical areas in maternal healthcare, focusing on precision, consistency, and comprehensiveness in documentation. Antepartum care, the period before childbirth, is a pivotal phase where maternal and fetal health are monitored closely, complications are addressed, and strategies for safe delivery are planned. High-risk pregnancy is characterized by conditions like preeclampsia, gestational diabetes, multiple gestations, or preterm labor risk, demand even more rigorous attention to detail and proactive care coordination. Advanced medical scribes play an integral role in capturing and managing this complex data, ensuring it is communicated effectively for the benefit of all stakeholders involved in patient care. As your antepartum reporting involves documenting a wide scope of information from routine prenatal follow-ups to intricate risk assessments. A patient's medical history, including chronic conditions like hypertension or thyroid disorders, must be linked seamlessly with their obstetrical history, such as outcomes of previous pregnancies or miscarriages. These elements are critical not only for managing the current pregnancy, but also for anticipating and mitigating risks. For instance, a woman with a prior history of preeclampsia might require early monitoring of blood pressure trends or preventative treatments like low-dose aspirin. Scribes can act as the vital bridge in meticulous data collection, ensuring that medical providers have real-time access to structured, comprehensive records. One of the biggest challenges in managing high-risk pregnancies is the interdisciplinary nature of care. Obstetricians often work in conjunction with maternal fetal medicine specialists, endocrinologists, neonatologists, and other healthcare professionals. Effortless communication across these disciplines relies heavily on well-documented and accessible records. A scribe must be proficient in noting all relevant updates. What So, a scribe must be proficient in noting all relevant updates while maintaining clarity, such as input from fetal growth ultrasounds, laboratory test results, and patient reported symptoms. Documentation needs to be forward looking, helping providers plan interventions like early inductions, cesarean deliveries, or post delivery and ICU, neonatal intensive care unit admissions for at risk neonates. Equally important is the need to document sensitive patient provider discussions, topics like advanced maternal age, lifestyle modifications to mitigate risk factors, or decision making on invasive diagnostic procedures such as amniocentesis should be recorded respectfully yet comprehensively. This ensures legal compliance and provides a defensible record in the case of medical legal reviews. Precise antepartum documentation promotes continuity of care, which is particularly indispensable in high-risk cases, often involving frequent follow-ups and longitudinal care plans. For instance, tracking gestational diabetes requires documenting patterns in blood glucose levels, dietary adherence, and insulin therapy adjustments. Similarly, monitoring a patient with high risk of preterm labor might involve recording serial cervical measurements and prescribed interventions like progesterone supplementation or cerclage procedures. Continuity in reporting not only optimizes health outcomes but also fosters trust between patients and their healthcare teams, reassuring them that every detail of their care is fully understood and accounted for. Lastly, the ethical and legal implications of antepartum reporting cannot be understood. Medical scribes must adhere to HIPAA regulations to protect sensitive patient information while also meeting the critical requirements of ICD 10 and CPT coding standards for accurate billing and documentation compliance. Detailed records ensure the transparency during billing processes while safeguarding both patients and healthcare providers from potential disputes or liabilities. Key points: comprehensive history taking in antepartum reporting. Effective history taking is at the heart of antepartum documentation. It forms the basis for accurate diagnosis, risk evaluation, and treatment planning. Obstetrical history definition here details prior pregnancy outcomes, complications or interventions using the GTPAL format: gravid, term birth, preterm birth, abortions, living children. Example: a patient's history reads G4P1113, indicating 4 pregnancies, 1 full-term birth, 1 preterm birth, 1 abortion, and 3 living children. Relevance here helps identify patterns such as recurrent preterm labor or history of cesarean delivery that influence care decisions. And here is a summarized diagram summarizing the core of antepartum care. On the left, effective history taking; on the right, accurate diagnosis, risk evaluation, and treatment planning. Medical and surgical history. Critical data: chronic conditions, for example, diabetes, hypertension, and past surgeries, for example, myomectomy, cesarean section, must be documented. Example: history of type 1 diabetes diagnosed at age 12, cesarean section in 2018 due to breech presentation. Impact enables preemptive management of complications like gestational diabetes or uterine rupture. Maternal family history importance here includes relevant hereditary conditions, maternal age, and genetic predispositions. Example: family history of Down syndrome, mother age 38 at conception. Utility: directs prenatal counseling and screening such as first trimester genetic testing. Lifestyle and behavioral history focus areas: smoking, alcohol use, diet, exercise, and compliance with prenatal care. Example: patient reports smoking cessation at 10 weeks gestation, adherence to folic acid supplementation. Outcome: guides lifestyle interventions and risk reduction strategies. And here is a summarized diagram summarizing the contributions to preemptive healthcare management. On the left, past surgeries; on the right, chronic conditions. Documentation standards. Standardization and accuracy in documentation ensure continuity of care and mitigate risks in high-risk pregnancies. Adherence to SOAP framework structure subjective patient-reported symptoms, objective clinician findings, assessment, condition evaluation, and plan treatment steps. Example: subjective reports headaches and visual changes, objective blood pressure 160 over 100, 24-hour protein 300 milligram. Assessment: preeclampsia, plan admit for magnesium sulfate and monitoring. Value here simplifies record navigation for healthcare providers and ensures all details are captured systematically. ICD-10 and CPT compliance purpose here enables accurate diagnosis and procedure coding for legal compliance and billing. Example: coding O10.1, pre-existing hypertension complicating pregnancy, and 59000 amniocentesis procedure. Outcome: prevents audit flags and insurance claim denial while ensuring clear documentation of care provided. Timeliness and chronological clarity. Best practice here: notes must be completed in real time or shortly after encounters with clear timestamps. Example: ultrasound images reviewed at 10 a.m., MFM consultation concluded at 10:45 a.m. Benefit provides a defensible litigation record and avoids documentation gaps during emergencies. Handling sensitive information, high risk pregnancies often involve private, emotionally charged discussions that demand careful documentation and handling. Confidentiality and HIPAA compliance approach ensure secure access and avoid unnecessary dissemination of sensitive details. Example, lock charts with sensitive information about substance abuse disclosed by the patient. Impact preserves trust while meeting legal requirements. Empathy and non judgmental language practice here document sensitive topics in an impartial, respectful tone. Example, patient expressed concerns about financial strain affecting adherence to therapy. Benefit encourages openness and comprehensive care planning. Mandatory reporting requirement here document and report cases of abuse, neglect, and endangerment as legally required. Example, patient revealed history of intimate partner violence, social services contacted through mandated channels. Outcome safeguards patient well-being and complies with legal obligations. Supporting multidisciplinary care, high-risk pregnancies often require input from a collaborative team of specialists. Proper documentation ensures seamless communication. MFM, maternal fetal medicine consultations, role accurately transcribe findings from advanced imaging or genetic testing reviews. Example, MFM notes show third trimester IUGR delivery scheduled at 37 weeks. Value optimizes outcomes with informed team decision making. Neonatal care coordination focus here record preparations for NICU admissions or interventions for expected complications. Example, steroids administered at 30 weeks for fetal lung maturity confirmed NICU bed availability. Impact here minimizes neonatal morbidity through proactive planning. Labor and delivery planning details capture decisions around induction, cesarean sections, or pain management. Example, elective cesarean at 39 weeks planned due to placenta previa. Outcome reduces delays and enhances patient satisfaction. Chronic risk management. Chronic conditions pose unique risks in high risk pregnancies. Ongoing monitoring and documentation are critical. Gestational diabetes monitoring, example, record glucose readings, dietary adjustments, and insulin usage patterns. Benefit prevents complications like macrosomia or neonatal hypoglycemia. Hypertension and preeclampsia focus here blood pressure trends, therapy effectiveness, and test results. Example, blood pressure BP stabilized with labetalol 100 mg BID, weekly protein screening in place. Outcome avoids critical complications like eclampsia or placental abruption. Thyroid dysfunction documentation needs include thyroid panel results and medication titration details. Example, TSH goal of less than 2.5 achieved, levothyroxine dose adjusted to 150 mcg. Relevancy reduces fetal neurological risks and improves pregnancy outcomes. Summary tables. Next, we have tables to summarize what we have covered through this lecture. A table on key components of antepartum history taking, component description, example, importance, risks if ignored. Components, we have obstetrical history, medical history, surgical history, family history, lifestyle history. Table on essential documentation standards, documentation standard, description, example, benefit, risks without standard. Documentation standards, we have SOIP note framework, accurate ICD-10 CPT code and CPT codes, real-time entry, comprehensive detailing, privacy, and HIPAA adherence. Table on handling sensitive information, sensitive aspect, description, example, importance, risk of neglect. The sensitive aspects, we have protecting confidentiality, non-judgmental language, cultural sensitivity, documentation of abuse, and consent handling. Table on multidisciplinary care coordination, scenario, teams, or specialists collaborated with. Example, documentation role impact. Scenarios, we have high-risk maternal conditions, NICU preparedness, imaging and diagnostics, behavioral counseling, emergency scenarios. We have table on chronic disease management during pregnancy, chronic condition monitoring priorities. Example, role of documentation, risks of neglect. Chronic conditions, we have gestational diabetes, hypertension, slash preeclampsia, and respiratory diseases. Again, uh, uh, table of chronic disease management during pregnancy, which is continuation, thyroid disorders, continuing the chronic conditions, thyroid disorders, autoimmune disorders. Next, we have the questions, MCQs or multiple choice questions to use to revise what we have covered through this lecture. Question one, what is the purpose of documenting GTPAL information during antenatal visits? A, to record a patient's insurance details. B, to summarize the outcomes of previous pregnancies. C, to document the patient's lifestyle habits during pregnancy. Or D, to capture the names of care providers during past deliveries. Answer is C. Actually, B, to summarize the outcomes of previous pregnancies because it's about gravida, term birth, preterm birth, abortions, living children's, or living births, or living children's. So summarize, it's a summarize. So answer is B, to summarize the outcomes of previous pregnancies. As GTPAL, gravida, term, preterm, abortions, living is a structured format specifically used to document a woman's pregnancy history. It helps identify patterns and predict risks for the current pregnancy. Question two, which best practice ensures compliance with legal and privacy standards in antepartum documentation? A, storing prenatal records with open access to all staff. B, avoiding documentation of medically sensitive information. C, restricting access to sensitive patients' records only to authorized personnel. Or D, excluding timestamps to prevent information overloads. Answer C, restricting access to sensitive patient records only to authorized personnel, as complying with HIPAA regulations involves securing sensitive data and ensuring that only authorized healthcare providers can access confidential prenatal records. Question three, what is the function of standardized ICD-10 and CPT coding in antepartum reporting? A, to simplify patient-provider communication. B, to ensure accurate diagnosis, documentation, and treatment billing. C, to prioritize high-risk pregnancies in lab appointment schedules. Or D, to serve as a replacement for conclusions in SOAP notes. Answer is B, to ensure accurate diagnosis, documentation, and treatment billing. The use of ICD-10 and CPT codes ensures precise documentation for clinical, legal, and billing purposes, which is essential for high-risk pregnancy cases to avoid legal or financial discrepancies. Question 4. Why is documenting multidisciplinary care coordination important during high-risk pregnancies? A, to reduce the workload of specialists. B, to keep the patient unaware of complex medical decisions. C, to ensure accurate collaborative communication among all care teams. Or D, to replace provider-patient discussions. Answer C, as to ensure accurate collaborative communication among all care teams, as multidisciplinary care requires seamless documentation to align all involved specialists, such as obstetricians, maternal fetal medicine providers, neonatologists, ensuring that patient care is cohesive and timely. Question 5. What critical information should be prioritized when documenting a patient with gestational diabetes? A, recording the patient's favorite meals during pregnancy. B, tracking glucose levels, dietary adherence, and insulin adjustments. C, omitting lab results to avoid overwhelming the care provider. Or D, focusing only on dietary habits without including medical interventions? The answer is B, as tracking glucose levels, dietary adherence, and insulin adjustments. As comprehensive documentation is essential in gestational diabetes management to monitor condition stability and avoid complications such as macrosomia or neonatal hypoglycemia. And here we come to the end of this lecture. Thank you very much and goodbye.